Okay, part 3 of the integumentary system. Okay, so the overall functions of the skin. Protection. So obviously chemical, physical, and mechanical barrier against the outside world coming into your body. It helps regulate temperature, so the vessels can dilate to help you cool and constrict to help you stay warm. It also can increase the sweat gland production to help cool your body. It acts as a really good touch and pain receptor. It also has metabolic functions, so when you go out into the sun, your body will, your skin, cells in your skin will actually start to produce vitamin D, and which is important for certain metabolic functions in your body. It's also a blood reservoir, so skin's blood vessels store up to 5% of the body's blood volume. And also excretion. Limited amounts of nitrogenous waste are eliminated from the body in sweat. Skin cancer. Most skin tumors are benign and do not metastasize. A crucial risk factor for non-melanoma skin cancers, though, is the disabling of the p53 gene. And newly developed skin lotions can help fix damaged DNA. So skin cancer usually occurs because of the ultraviolet radiation that's coming from the sun, penetrating your skin, getting down to that layer where you have dividing skin layers, and the radiation from the sun actually alters your DNA and could eventually cause it to become cancerous. And those lotions can help fix that damaged DNA, so it can kind of undo some of the damage that was done. There are 3 major types of skin cancer that we're going to talk about. Of course, these do not encompass all types of skin cancer, but these are the 3 major ones. First, we have the basal cell carcinoma. It's the least malignant and most common type of skin cancer. So the stratum basale cells proliferate and invade the dermis and hypodermis. So that was that very bottom, the deepest layer of the epidermis where the cells are still dividing. So they kind of start dividing out of control, and they start invading the dermis and even down to the hypodermis. It's very slow growing, and they often do not metastasize, and usually can be easily removed by just surgery. So this is why it's important to keep an eye on your skin and any moles or anything on your skin to make sure that you are watching things and you're aware of what your skin is supposed to look like, so that you can tell if there were ever to be any changes, such as some kind of skin cancer. Squamous cell carcinoma arises from the keratinocyte. So again, these are the cells that produce the keratin in the stratum spinosum. They most often are seen on the scalp, ears, and lower lip, and these are areas that typically see a lot of sunlight. They grow rapidly and can metastasize if not removed. But if you do catch them, it's a pretty good prognosis, and usually surgically removing them and then radiation can help get rid of it. Melanoma is the most dangerous type of skin cancer, and this is because it's highly metastatic, which means it can spread really easily. So what starts out as skin cancer can quickly become cancer in other parts of your body, and it's hard to treat because it's resistant to chemotherapy. So identifying melanoma is very important, and this is something that everybody can do, and then you could go see your doctor should you suspect anything. And we follow the ABCD rule. First, you look at the asymmetry of a mole. So if the 2 sides of the mole don't match, then that's one sign. The next one, B, is border. Is the border irregular and exhibits indentations? So you can see in this picture here, both of those things are true. The one side, so if you draw a line either way, one side doesn't match the other side, the color doesn't match the other side, the border is irregular. Normally moles have pretty much a rounded look, and this one is very irregular. So C, color is black, brown, tan, and sometimes red or even blue. So if you see a mole that has always been one color and then all of a sudden changes colors and starts looking different, then that's one of the times when you might want to go ahead and go see the doctor. Also, D diameter. Is it larger than 6 millimeters, which is about the size of a pencil eraser? Now, sometimes if you've had a large mole your entire life and it's always been there and it's never changed, it's probably fine. It's just one of the places that you should want to keep an eye on over your lifetime. Treating melanoma, usually they do a pretty big surgical incision, and then there's some kind of immunotherapy. So when they remove it, they have to remove not just the mole, but they usually remove tissue that's around it as well to make sure that they try to get all of the cancerous cells that are there. And the chance of survival is poor if the lesion is over 4 millimeters thick, though cancer treatment is getting better and better. Okay, lastly, burns. First degree burns is where just the epidermis is damaged, and it's usually pretty painful. It's red, it could be swollen, but you don't have any blisters yet. So usually a sunburn is going to be a first degree burn, but sometimes you can have really bad sunburns that actually turn into a second degree burn. Second degree burn is where the epidermis and upper portions of the dermis are damaged. The symptoms are similar to a first degree burn, but you also have blisters at this point. And then a third degree burn is the entire thickness of the skin is damaged. The burned area appears gray or white. It could be very bright red or sometimes even black. There is no initial edema, which is swelling, or pain. The reason why is because the nerve endings are actually destroyed. So if you have a burn that's so bad that your skin becomes blackened and charred and doesn't hurt that much, that's probably a third degree burn. Okay, other skin issues. So when babies are born, they kind of look kind of hairy, like the picture at the top. And this is called lanuga, which is a really delicate hair that newborns have, and it kind of is there to help protect their skin. You also have the vernix caseosa, which is produced by the sebaceous glands and helps protect the skin of the baby when they're in the amniotic fluid. So a baby is sitting for 9 months submerged in amniotic fluid. And normally skin would become completely saturated and it would be very damaging to human skin. But they secrete this layer, this oily kind of waxy stuff that coats their skin, which is why when babies are born they look kind of gross. And it helps protect their skin against that fluid.